It's like having this 10 out of 10 wife at home that's a model and she's flawless, and you're just every day in the shower and you're jacking off and doing nothing else. Exploring human potential and really optimizing every little corner of our biology is our favorite thing to do here at Unyielding Vigor. If you follow this channel, you know what you're here for. You're here for the little Easter eggs and secrets and really exploring the untapped potential of everything in the human body and the world of pharmacology, right? Well, in order to do that, we can't really be exploring just these mainstream ideas of metformin and rapamycin and all that good stuff. I'm here to really dive into the realm of sex hormones with you, where when you hear about sex hormones, you instantly think of, oh, males testosterone, females estradiol, right? Well, that's not a bad point of view to take. That's not a bad set of knowledge, but if you dig deeper and take a more nuanced position, you'll see an unsung hero in there that's called progesterone. And today we'll talk about progesterone and really its various unique roles in the human body that truly make it something that some people can benefit from supplementing with. Let's start off with a realm that really everybody's interested in, which is how this molecule can help you be the best version of yourself, maybe the smartest version, the calmest version, the happiest version, etc. So number one, let's talk about a neurotransmitter called GABA. Now, GABA is, to put it simply, your body's main inhibitory neurotransmitter, whereas glutamate is your body's main excitatory neurotransmitter. Now, if you've seen someone convulsing or seizing in movies, you think of a condition called epilepsy, and epilepsy, the main theory that explains it is a disbalance between excitatory or glutamatergic and inhibitory or GABAergic signaling in the brain. So how does that relate to progesterone exactly? Progesterone has many metabolites, like all sex hormones have many metabolites, but one of its main metabolites, which is called allopregnanolone, is a positive allosteric modulator of the GABA A receptor. Now, if someone presents to me in the ER that's seizing, and I'm instructed to treat this person, the first step is to take care of their ABCs, airway, breathing, and circulation. But the second step is, if I had IV access, I would do 4 milligrams of lorazepam. No IV access, 10 milligrams of midazolam intramuscularly. These are also positive allosteric modulators of the GABA A receptor. These molecules that are positive allosteric modulators of this receptor will reduce glutamatergic signaling or glutamatergic response and increase the GABAergic response or signaling in the brain. So how would that relate to you? It's going to help you be the best version of yourself in terms of not having anxiety, in terms of feeling good. And you can see actually in the studies on postpartum depression of an allopregnanolone based treatment used in these women. Brexanolone, I believe, was the exact name of the drug, and yes, it is an allopregnanolone based treatment, but it really doesn't just do that through the GABA A receptor, and there seems to be other mechanisms that are not fully understood. But another one of them is its effect on dopamine. So for example, one of my favorite examples is this study on rats that were given morphine, and how allopregnanolone treatment, in addition to morphine, actually increased dopamine transmission within a structure in the brain called the nucleus accumbens. Now, the nucleus accumbens is a part of your mesolimbic pathway. It is a part of your ventral striatum within the basal ganglia, and this structure is really responsible for a lot of the rewarding benefits of dopamine. So if you watch Andrew Huberman, you'll hear a lot about how awesome dopamine is and all that good stuff. But yeah, the nucleus accumbens is responsible for a lot of that. So this subcortical structure having an increased dopamine transmission in it as a result of allopregnanolone is really a very attractive feature of progesterone downstream. Now, while progesterone also has different metabolites, like I mentioned, that are also potentially potently psychoactive in really desirable ways, one of the other mechanisms of it that I really thought was interesting to bring up in this video is that progesterone seems to antagonize the 5-HT3 receptor. Now, 5-HT3 is a serotonin receptor that, when antagonized, very interesting things happen, including anxiolysis, which is the reduction in anxiety, as well as improved memory, interestingly. Now, this is one of the weird serotonin receptors that's not completely understood, but you have antagonists of this receptor that have actually improved anxiety and memory. And this receptor is also being interestingly targeted for schizophrenia specifically, which I find very odd and fascinating. But moving on, it's not really just the mental benefits and nootropic benefits of a compound that really make it worthy of being mentioned on this channel. But another thing is the health of the brain, neuroprotection, and really trying to protect yourself long term from neurodegenerative diseases. So one extremely interesting feature of progesterone is that it actually plays a role in the repair of myelin and stimulating myelin synthesis. Now, myelin or myelin sheath is this sort of fatty layer of tissue that surrounds certain neurons in your body, not all of them, but certain ones. And you may have heard of gray matter and white matter in the brain. Gray matter is not myelinated. White matter is myelinated. The really main function of myelin in the nervous system is to speed up conduction. But another function of myelin is that myelinated neurons seem to be able to heal better when they're damaged, or even I've seen evidence that unmyelinated neurons cannot even heal at all when they're damaged, interestingly. But yeah, having progesterone in your body helping with myelin synthesis and myelin repair seems to be very valuable, in my opinion, for protecting yourself from neurodegenerative diseases long term, as well as honestly in the short term. Because think of it like this, some examples of demyelinating diseases are things like multiple sclerosis or transverse myelitis, where there's a slow but continuous damaging of the myelin portion of your neurons. Okay, another example is something like B12 deficiency, right? But these diseases don't exactly give the phenotypic debilitating picture or clinical picture instantly. There is a slow buildup of damage that's going to result eventually in the reduction of function and disability long term. So really having that progesterone as a sort of shield protecting you from demyelination, even acutely, is something extremely valuable if you ask me. Now, there are quite a lot of studies that explore the neuroprotective effects of progesterone. So in order to not make this video like 6 hours, I thought I would bring you one that I really like. Here is one studying the occlusion of the middle cerebral artery in rats. So the middle cerebral artery, it supplies more of your lateral homunculus in your brain. Now, if this artery is occluded in, let's say, a human, okay, it causes contralateral weakness or contralateral hemiparesis, but usually it's more in the upper limb and face. Contralateral loss of sensation also in the upper limb and face, in addition to contralateral what's called homonymous hemianopia. So if I have a middle cerebral artery occlusion in my right hemisphere, I will lose the left visual fields in both of my eyes. Another thing is that if this stroke can happen in your dominant hemisphere, you can develop something called Wernicke's aphasia or Broca's aphasia. Broca's is more expressive, Wernicke's is more receptive, etc. I'm not going to go into the full pathophysiology of strokes. I don't even know I said all of that. But anyway, in this study, they occluded the middle cerebral arteries of rats and then administered progesterone. Obviously, there's a control group and an experimental group, right? In the experimental group, the progesterone administration resulted not only in an increase of BDNF concentration, BDNF being brain-derived neurotrophic factor, a growth factor in the nervous system that can protect neurons, as well as grow neurons in specific areas of the brain. We're not going to talk about that. But it also reduced cerebral edema. Now, this is extremely valuable in my opinion as a signal or suspicion that progesterone can be used in traumatic brain injuries as well as people who take a lot of head trauma. Okay, because so if someone has a stroke in the hospital, really, if the cerebral edema gets way too out of control, it can lead to something called an increase in intracranial pressure. And that's something you really want to lower because your skull can only, like, your brain can only expand so much inside your skull before it herniates or starts pressing on the fissures of your skull, resulting in really permanent brain damage in the sense that it's phenotypically not gonna go away. So that's why in the hospital, if someone has really voluminous cerebral edema that's out of control, we have to give them something like mannitol or hypertonic saline in order to shrink their brain to not let it enlarge too much and press on the skull too much and resulting in seizures and like I said, permanent phenotypical brain damage and so on. So lowering that cerebral edema is extremely valuable. In addition to that, it actually lowered vascular endothelial growth factor in the brain after stroke without altering the vascular structure, which is very interesting. Not really important in this case, but very interesting nonetheless. Moreover, progesterone has quite unique benefits on sleep, where having, for example, in postmenopausal women, if they take progesterone back to a physiological level before menopause, they really have not only better sleep, but it also modulates their secretions of growth hormone in their sleep, their TSH in their sleep, and their melatonin in their sleep. It is quite profound, okay? And every client that I've had whom I've given progesterone to because I thought it was necessary, male or female, they usually all, I've never had this not happen one time. They all report better sleep, as in better sleep onset, more restful sleep, and really, like I said from the first chapter about the mood, they really have better mood overall, and in general, just a better sense of well being and feeling like a better version of themselves. Now, these last two effects I might categorize as miscellaneous, but yeah. One of them is really progesterone has some unique effects on the respiratory system, where I've seen it being used in polycystic ovarian syndrome and improved pulmonary function, even though in polycystic ovarian syndrome, really pulmonary function is not that affected. But it improved it. It improved the forced expiratory volume in the first second, as well as the forced vital capacity, which are markers used in spirometry to measure the function of the lungs. That's why they call it lung function test. I don't know, I didn't say that in the beginning. But it's also, you got progesterone analogs having been used in a really horrible respiratory disease known as chronic obstructive pulmonary disease. And interestingly, they've actually improved respiratory symptoms in a disease as bad and advanced as that. So that really is something I found very interesting and worth exploring more, but the literature's not super deep on this topic, okay? Another thing is that progesterone in postmenopausal women is actually incredible for hair. Okay, even Dr. Peter Attia said that in the postmenopausal women he treats with HRT, they actually have more pronounced outcomes on their hair with progesterone than just estradiol. So adding progesterone in really has a positive cosmetic effect on the hair of these women. However, interestingly, I have anecdotally found progesterone to be more beneficial for my hair than just dutasteride. Okay, now in males, it's really thought to not have any benefits apart and beyond from inhibiting 5-alpha reductase to a certain extent, right, in the scalp. But I've seen that, I don't know, maybe it's just an anecdote that's worthless, right? But I've had it really benefit me. So with all these awesome benefits that I've listed and physiological functions and cool mechanisms, does that mean you should go as a male and start swallowing progesterone pills, or even as a female? Not really. Like for example, in males, progesterone is really gonna inhibit your hypothalamic, pituitary, and testes axis. Okay, it's gonna downregulate it to nothing. Okay, so that's one thing you wanna avoid. Don't go out of your way and take it for no reason. I'm only talking about it in specific situations that we have faced with certain types of clients. All right. Now, for example, if you are a male and you're on TRT, okay? The majority of the progesterone in your body, if not pretty much all of it as a male, is synthesized through the agonism of your LH receptor, luteinizing hormone chorionic gonadotropin receptor, or LHCG receptor, right? And if you're taking exogenous TRT, okay, you have pretty much no progesterone synthesis, really, almost. And it's like having this 10 out of 10 wife at home that's a model and she's flawless, and you're just every day in the fucking shower and you're jacking off and doing nothing else if you take TRT without progesterone. And that's just one of the examples. Another example, we're gonna make a video about this soon with her consent, but we've had a call from a woman who's had 2 prior miscarriages and she was trying to conceive later in life. And through high dose progesterone, so having prior miscarriages is a risk factor for preterm labor, or like premature labor, you know, having a baby born premature, but also trying to conceive later in life is, like, I think it's after 35, that's the cutoff, is also a risk for preterm labor. And through high dose progesterone, we were actually able to allow her to have a normal gestational period, having a normal child, giving birth to a really lovely baby girl. And yeah, it's not about going and swallowing all the progesterone pills you can right now. It's about for a specific person in a specific situation, progesterone is awesome. For me personally, it's been a game changer for my TRT journey. Really, TRT on its own without progesterone is garbage. For me personally, it was garbage. Like anxiety and just real anger all the time. And honestly, it's something that, free tip, you should take on all of your cycles pretty much, unless you're on high doses of, let's say, 19-Nors or Anadrol or any really other molecule that can agonize the progesterone receptor directly, even though they might not have the exact physiologic response as progesterone when you take them. But yeah, just to not have excessive progestogenic signaling. But anyway, I thought this would be a fun video to make that I haven't really seen explored. This topic is not very well explored. This was medically enhanced Ali, Mr. X from Unyielding Vigor. If you like this video, bless us with a like and a comment and subscribe, and yeah, informative videos, all the good stuff. Welcome to the channel, and yeah, goodbye.